Hello everyone, thank you for joining this month's webinar. This topic is the link between the heart and the kidneys, and this was actually requested by one of our members. So our presenter this month is Robin Glock. She's an RN and a health coach with Strategic Health Services. Robin? Hi, thanks everybody for joining in with the March webinar, which is, as Dawn said, the link between the heart and the kidneys. We are going to cover just a basic overview of the heart and kidney functions, and then that link between heart and kidney disease. That also talk a little bit about what increases your risk of disease and any lifestyle changes that you can take to improve your overall health. So first we'll start off with, what does the heart do? The heart is a muscle that pumps blood filled with oxygen to all parts of the body. This job keeps every cell, organ, and system alive within your body. To move blood to each part of your body, your heart does rely on blood vessels, and together the heart and the blood vessels make up a system called the cardiovascular system. Try to think of this as a delivery system. The heart sends blood throughout your body, and it is carrying blood that provides fresh oxygen to the lungs and nutrients to the body's tissue. It also takes away the body's waste products, including carbon dioxide, away from the tissues. This process is necessary to sustain life and promote the health of all body parts. In addition to carbon dioxide, the circulatory system picks up metabolic waste products and toxins, transports them to the liver, kidneys, and lungs for eventual elimination from the body. Now we'll talk a little bit about what the kidneys do. Your kidneys are two bean-shaped organs, and they're usually about the size of your fist. They're located a little bit below your rib cage and to the left and right of your spine. The kidneys play an important role in keeping your body functioning properly. According to the National Kidney Foundation, there are 5 top jobs that a healthy kidney performs. First one is removing waste and extra fluid. Your kidneys act like a filter to remove waste and extra fluid from your body. Your kidneys filter about 200 quarts of blood each day to make about 1 to 2 quarts of urine. And this urine contains waste and extra fluid, and this prevents the buildup of waste and fluid to keep your body healthy. Secondly, they control blood pressure. Your kidneys need pressure to work properly. Kidneys can ask for higher pressure if it seems too low, or try to lower pressure if it seems too high by controlling fluid levels and making the hormone that causes the blood vessels to constrict. Making red blood cells. Your kidneys have a hormone called erythropoietin, and this tells the bone marrow to make red blood cells. And red blood cells carry oxygen from your lungs and supply all of your body's needs. Red blood cells also give you the energy you need for daily activities. The kidneys can actually help keep your bones healthy. They make an active form of vitamin D, and you need this vitamin D to absorb calcium and phosphorus. Calcium and phosphorus are important minerals for making your bones strong, and the kidneys also balance that calcium and phosphorus level so your body has the right amount. And then lastly, controlling pH levels, which is a measure of acid and base. Your kidneys maintain a healthy balance of chemicals that control these levels. Your kidneys balance the pH of your body by either removing or adjusting the right amount of acid and buffering agents. So heart disease and kidney disease. Researchers have been working to understand the clear relationship. When your heart or kidneys cannot function normally, it can lead to heart disease or kidney disease. So it's important to know that having kidney disease can directly affect your chances of developing heart disease, and then having heart disease can directly affect your chances of developing kidney disease. In fact, for heart disease and kidney disease, they share many of the same risk factors, such as diabetes and high blood pressure. The heart pumps blood with oxygen throughout the body, including the kidneys, and then the kidneys clean the blood, removing the waste products and extra water. So without the kidneys, your blood would have too much waste and water, and without the heart, your kidneys would not have enough oxygen-filled blood needed to carry on those important jobs. So they do work closely together and directly affect each other. So what's the risk? the heart and kidneys are very connected. While your heart, like we just talked about, is constantly pumping blood through your body, the kidneys are continuously filtering in order to remove the waste and the excess fluid. Since they work so closely together, it's not a surprise that many of the risk factors are the same. So if you have high blood pressure, that can directly be a risk factor. So uncontrolled blood pressure can damage blood vessels, reducing blood supply to the kidneys, damaging the filters inside your kidneys, and then the kidneys stop removing that waste and extra fluid, which can lead to higher blood pressure or hypertension. Plus, high blood pressure is also a complication of kidney disease. So the diseased kidneys are unable to regulate the blood pressure, and that can be a complication as well. More than half of people with kidney disease have high blood pressure. Another risk factor is diabetes. Diabetes injures the small vessels in the body, and when those blood vessels are injured in the kidneys, they can't clean the blood properly. So you can retain fluid and have waste build up, which can lead to some problems within your kidneys. And lastly, high cholesterol. Cholesterol is a lipid. It's a fat substance found in your body. Your body does make cholesterol, but it also gets some of it from the foods that you're eating, some of those meats and animal products. When there's too much cholesterol in your body, it can clog blood vessels, making them more narrow, harder for the heart to pump the blood through the body. It's also something that can affect and narrow the blood vessels down with the kidneys. So it's important that you make sure that you understand what your numbers are, and you are following up with a physician to see what the best number range is for you. Keeping these numbers in a good range, having those checked can mean reducing your risk for disease. So how do I keep my heart and kidneys healthy? And I'm actually going to, we'll go over these points on the next few slides, but trying to keep that kidney and heart health on track, you should always, think about getting regular exercise, weight loss or maintaining a healthy weight, consuming a diet with less fat, keeping your numbers in a good range, stop smoking or don't begin to smoke, and then reducing your stress. So now we'll talk a little bit about getting more active. Daily physical activity increases the length and quality of your life. It is recommended from the American Heart Association that you get 30 minutes a day, 5 days a week. That's about 150 minutes per week of moderate exercise, or even 75 minutes per week of vigorous exercise. You'll also experience those benefits if you divide that into 2 or 3 segments of 10 to 15 minutes per day. So if you don't have a lot of time and you can squeeze in 10 or 15 minutes in the morning, and then you can do maybe 10 or 15 minutes in the afternoon, and then again in the evening, however it works best for your schedule. It's important to remember that with exercise, it becomes easier to get around. You are able to, you have a little bit more energy, and in addition to having more energy, it also helps improve your muscle conditioning and functioning. You can get better blood pressure control, improve your muscle strength, better sleep, better control of your body weight, and also can be shown to lower those cholesterol levels in your blood. Now we'll talk a little bit about keeping a healthy weight. It's important to maintain a healthy weight or lose weight. It is a controllable risk factor for heart disease. If you're overweight or obese, you're at a higher risk for developing chronic conditions like heart disease, high blood pressure, diabetes. When you think about the term BMI or body mass index, it's the number calculated from a person's weight and height. It's a screening tool used by the medical profession to evaluate possible weight problems. And it is determined that if your weight is a risk factor, keep in mind that just losing 5 to 10% of your body weight can have a positive impact on your overall health. It's important to speak with your doctor about what a healthy weight is for you. It's something that your physician will be able to evaluate just based on your current health, your family history, and your past medical history. Consuming less fat, that's something to consider whenever you're shopping and preparing meals. You want to look and choose lean meats, poultry, and fish. It's important to trim all that visible fat from your meat, remove skin from poultry. Think about steaming, broiling, roasting, or baking as opposed to deep frying and stay away from those fried foods. Think about choosing fresh fruits and vegetables to add to your meals, things that are not processed and higher in fiber, a good source of vitamins and nutrients. Try to stay away from heavy sauces and butter and Alfredo, those cream sauces. Try to spice your foods up with just some herbs and spices, and try not to weigh it down with those heavy sauces, which can be high in fat. Also think about using fat-free or reduced fat versions of foods that you eat every day. So an example would be if you are making something that requires sour cream, you could use the fat-free. You could replace your milk with 1% or skim milk. You could look at yogurt, for instance, and try to find your best option as far as the amount of fat. Sometimes reading food labels is important because you'll find that there's hidden cholesterol in foods that you wouldn't think have cholesterol in them. One thing you may find also is if the label says it's cholesterol-free, sometimes it's high in saturated fat. So just taking a look at the food labels and just trying to pick your best sources of foods that are lower in fat. Another thing to consider with blood pressure is sodium. That's another thing that you could be focusing on, and just making sure that you're not eating a lot of foods that are processed, hot dogs and things that are prepackaged, a lot of the frozen meals, and just trying to stick with less than 2,300 milligrams of sodium a day. And so, in the scheme of things, try to focus on just getting better foods, fruits and vegetables, lean proteins, lower fat dairy, some whole grains, and that can sort of offset and help you just maintain a healthier diet. Now we'll talk a little bit about keeping your numbers in a good range. The goal for blood pressure is to be less than 120/80, which is the national standard. So that does vary. People who are treated for chronic kidney disease, that number can go, they want you to be less than 140/90. If you are a diabetic with kidney disease, it's 130/80. So again, your best numbers and that most appropriate range will come from your physician, but it's important to try to keep your blood pressure in a good range. There is a condition called renal hypertension that can develop if you have an elevated blood pressure from kidney disease, and they do control that with blood pressure medication, but it's caused by the narrowing in the arteries that deliver blood to your kidneys, and it can affect one or both of your kidneys. So this renal artery stenosis or narrowing is often caused by atherosclerosis, which is that hardening of the arteries, that same process that leads to strokes and heart attacks for heart disease. And so when the kidneys are receiving low blood flow, they act as if that flow is from dehydration. They respond sort of by releasing more hormones that stimulate the body to retain salt, sodium, and water, and this can cause your blood pressure to go up. So it's just important to know what your numbers are, try to keep them in a good range for optimal health. The second number that you should try to keep in good range is your blood sugar. The national standard is to keep your fasting blood sugar less than 100. So if you're a diabetic, it's important to check your blood sugars as often as directed by your physician, discuss what your best number is, consider tracking, keeping a log, and trying to really keep an eye on your blood sugar numbers. With diabetes, those small blood vessels in your body are injured, and when those vessels in the kidneys are injured, your kidneys cannot clean your blood properly, and you'll retain more water and salt, which can lead to weight gain and ankle swelling, and you may also have a buildup of waste in your bloodstream. So keeping your blood sugar in a good range reduces the chance of having worsening changes in your kidneys. And then lastly, your cholesterol. Knowing what your cholesterol is, keeping those numbers in a good range. If you have too much cholesterol, it can build up in your blood vessels, and this narrowing can lead to blockages, preventing blood from getting to certain areas of the body. And this can occur in your heart vessels, which is coronary disease, and can cause a heart attack. And again, it could also cause some renal artery stenosis like we talked about, and some narrowing in those vessels down in the kidneys, which can lead to problems with kidney disease, and then having chronic renal insufficiency. So when you think about what is your most important cholesterol numbers, it's just sort of knowing where you are. And then if you're being treated for cholesterol, just following up with your doctor. Most times the recommendations is a once-a-year cholesterol panel, but if you're being treated, they may opt to check you more often. So just have a good rapport with your physician and keep up with knowing what your numbers are. And smoking cessation. So it's important to recognize that smoking is a major risk factor for heart disease for both men and women. Quitting does reduce that risk for coronary heart disease, stroke, and peripheral vascular disease. And a person's risk of heart disease and heart attack increases with the number of cigarettes he or she is smoking. So people who smoke do have a 2 to 4 times higher chance of having heart disease. The nicotine in smoke can affect your heart by decreasing oxygen to your heart. It increases your heart rate and your blood pressure, and it is damaging to the cells that line the coronary arteries and other blood vessels. So smoking slows blood flow to important organs, such as the kidneys, and can actually make kidney disease worse. And lastly, reducing your stress. Stress can affect your health in many ways. Managing your stress is good for your overall health and will help you prevent and control many chronic conditions. Many factors contribute to feeling stressed. Although you can't change everything, there is on some level daily stress, which is healthy, but then you move into stress that is chronic and long-term, and that can lead to the long-term effects of chronic stress, which is high blood pressure and arrhythmia, heart disease, heart attack, weight gain, which, is a lot of that is the weight gain and the weight loss is from changes in your eating patterns. So if you're stress eating, that can lead to weight gain, or you can become malnourished if you're not, somebody that eats when they're stressed. So you got to just think about what is causing you stress. Sometimes it's a recent death in the family, a divorce, a change in jobs. Try to replace some of those unhealthy habits with some healthier habits. So think about, get moving, develop maybe an exercise routine, take a walk with a friend, take a few minutes to kind of, do some deep breathing exercises and relax, listen to some music. Think about ways that you can reduce your stress, develop some sort of coping mechanism, some things that you can put in place when you feel like you're under stress, and try to maybe think about ways that you can connect with other people who are either going through similar situations, or you have family or friends that are sort of low stress, people that are really good to connect with, that can help you feel, better about certain situations and at certain times of the day. And lastly, take some time for yourself. A lot of times we're so busy taking care of others or just going through the motions of our day that we don't take any time to connect with ourselves, take a few minutes to maybe read a book, or focus on doing a few things quietly for yourself so that you can focus and be better for other people. So bottom line, stress can be good or bad, and you definitely want to try to reduce chronic stress and stress that you feel like is compounded and making things worse on a daily basis. And now we'll talk a little bit about a healthy partnership with you and your doctor. So a crucial step in determining your risk is to see your doctor for a thorough checkup. Your doctor can be an important partner in helping you set and reach goals for heart and kidney health. If you know your cholesterol levels, your body mass index, your blood pressure, blood sugar numbers, you can have better control over your health and your risk. So work with your doctor to develop a plan to keep your heart health numbers under control, which directly affects your kidney health. And then just when you go into the office, be open and honest with the doctor so they have a clear picture of your current health and risk factors, and ask questions. Be sure you understand what your doctor's telling you. Take notes if you need to, bring a friend with you. Just have a good, clear understanding of what you, are trying to take away from the appointments and how you can focus on your health and wellness. Thank you for joining the webinar. I hope you enjoyed this webinar about the kidney and heart health. And if you have any questions, feel free to send us a message. Thanks. Have a great day.